Welcome to Harmony Fire Department's presentation, Emergency Medical Services, the History of EMS in the U.S. and EMS, Past, Present, and Future. Some of this information may be new to some of you, while for others, well, you may have actually operated some of the equipment or driven some of the vehicles that are pictured in our presentation. We hope that you enjoy the show. The roots of emergency medical services can be traced back to the 1700s. Jean-Dominique Leray, Napoleon's chief physician, developed modern methods of army surgery, field hospitals, and a system of army ambulance corps. Over the years, war has impacted emergency medical services and made several contributions. The Union Army developed an organized system to evacuate soldiers from the battlefield. During those days, a lot of soldiers didn't die from the actual trauma, but from the infection that ensued. Even today, we embrace hand washing, using personal protective equipment to avoid cross-contamination, and paramedics are able to administer antibiotics to patients with severe trauma to avoid the risk of infection. Ambulances of the 1800s included horse-drawn carriages, not a pleasant ride for most. Then on February 1st, 1899, the first motor-powered ambulance was commissioned. It was made possible by the donation of 500 prominent businessmen of that era. During the Korean War, the helicopter was used to transport injured soldiers from the battlefield to field hospitals. The helicopter is still an integral part of EMS today in both the military and the civilian arena. In the 1960s, approximately 50% of U.S.'s ambulance services were provided by 12,000 morticians. This is mainly because their vehicles could accommodate transport on a cot or a litter, with the patient laying flat. Ambulances of the 1960s were staffed with the responders trained in advanced first aid at best. It remained common for the local undertaker to staff the ambulance due to the vehicle's ability to transport the patients laying flat. They were merely a fast ride to the hospital. By the mid to late 1960s, the medical community was beginning to understand the benefits of early recognition, treatment, and transport in the event of a cardiac event or stroke. However, ambulances were still staffed with poorly trained personnel with little regulation, no standardized training, and no standardized equipment. Dr. Peter Safar is considered to be the father of CPR. He, along with his colleague, Dr. James Elam, proved that mouth-to-mouth CPR was effective. They went on to educate healthcare professionals and the public about CPR. Dr. Safar's contributions to pre-hospital care did not stop with his advancements in CPR. In 1967, he began training unemployed African American men. Freedom House Ambulance Service was born as the first EMT squadron in the United States. Pittsburgh's branch of Freedom House was credited as the first EMT trainees in the United States. Between November 1st, 1955 and April 30th, 1975, the U.S. was embedded in the Vietnam War. Concepts that continue to influence EMS care still exist today. Treatment should start at the patient's side, the use of the helicopter, and the use of several medical devices used during that era that are still in use today. During the 1960s, it became concerning that more people were dying on the streets and highways of America in accidental death at a higher rate than military personnel engaged in combat in Vietnam. The National Academy of Sciences and National Research Council Committees on Trauma and Shock developed the paper Accidental Death and Disability, the Neglected Disease of Modern Society. Once publishing this research paper, it became clear that both the government and public were insensitive to the magnitude of the problem of accidental death and injury in the United States. Standards to which the ambulance services were held were diverse and often low, and most ambulances used in this country are unsuitable, having incomplete equipment, carrying inadequate supplies, and are manned by untrained attendants. As a result of this research and the publication of the white papers, EMS would eventually fall under the umbrella of the National Highway Traffic Safety Administration. Increased funding, equipment standards, communication standards, organizational standards, and educational standards would improve. The first nationally recognized curriculum for EMS, Emergency Medical Technician Ambulance, was published in 1969. Most Americans today recognize 911 as the universal number to contact police, fire, or emergency medical services. On January 12, 1968, AT&T announced the adoption by the Bell system of 911 as a nationwide emergency telephone number in response to the express public need for a common, easy-to-remember number for police, fire, and ambulance, and other emergency services. AT&T announced the selection of 911 as a choice of the three-digit emergency number at a press conference in Washington, D.C. On February 16, 1968, Alabama Senator Rankin Fife actually made the first 911 call in the United States in Haleyville, Alabama. It was the Alabama Telephone Company that carried the call. By the 1960s, there were ambulances that could get patients to the hospital very quickly, but physicians became increasingly concerned about the lack of actual medical care being given to coronary patients during emergency transport to a hospital. In 1969, while serving as the president of the Los Angeles chapter of the American Heart Association, Dr. Walter S. Graff, who was a cardiologist, created a mobile critical care unit consisting of a Chevy van, a registered nurse, and a portable defibrillator. Ambulances of the 1960s into the 1970s included the hearse and van style. Some departments actually converted old delivery vehicles into ambulances. The ambulances of this time still lacked standardized equipment, diagnostic equipment, medication, and engineered safety controls to keep the occupants safe. At this period in EMS history, things were about to change for the better, and it had less to do with what the vehicle looked like and more to do with the education and training of the individuals providing patient care. July 15, 1970, less than 1 year after the implementation of the Mobile Critical Care Transport Unit, Wentworth-Townsend Paramedic Act of 1970 was signed into law by then California Governor Ronald Reagan. Paramedic training began the next month at the Freeman Memorial Hospital under Dr. Graff's direction. It was the first nationally accredited paramedic training program in the United States. 11 years later, President Ronald Reagan would require emergency medical treatment of his own after he was shot, critically wounded during an assassination attempt by John Hinckley Jr. Also in 1970, the first board of directors of what is now known as the National Registry of EMTs, NREMT, met to determine the feasibility of creating a national certifying exam. In 1971, 1,520 personnel took the first NREMT ambulance exam. The National Registry of Emergency Medical Technicians serves as the nation's EMS certification agency today. Prior to 1972, most Americans did not know what EMS was, let alone a paramedic, and the first paramedics had not yet tested. On January 15, 1972, this changed with the television hit series Emergency, starring Randolph Mantooth, who played John Gage, and Kevin Tighe, who played Roy DeSoto, two firefighter paramedics assigned to Los Angeles County Fire Department's elite paramedic intercept vehicle, Squad 51. They responded to medical calls, and viewers watched them use state-of-the-art devices including two-way communications, defibrillators, telemetry, and radio phones, each about the size of a small suitcase. In 1972, the first National Registry Emergency Medical Technician paramedic level examination was given in Minneapolis. That same year, the NREMT became a member of the National Commission for Health Certifying Agencies. EMT paramedic, now simply paramedic, became an approved health occupation. After more than a decade of watching military helicopters evacuate wounded soldiers from the battlefield, the first civilian hospital-based medical helicopter program in the United States began in 1972. The Omaha Orange Cross was utilized on ambulances to identify them as emergency medical vehicles, but in 1973, the American Red Cross felt it too closely resembled their logo, a red cross on white background, commonly used on military vehicles, and its use was restricted by the Geneva Convention. The National Highway Traffic Safety Administration EMS Branch Chief Leo Schwartz created the Star of Life. On February 1st, 1977, the Blue Star of Life was trademarked. Each of the 6 arms of the Star of Life represents one of the following: detection, reporting, response, on-scene care, care in transit, and transfer of care. The rod of Asclepius, the ancient Greek symbol for healing, remains in the center. Advances in ambulance design gave way to the Type 2 or van-style ambulance and Type 1 box-style ambulance of the 1980s. Paramedic programs began to emerge in the 1980s. Those who functioned as paramedics were educated and trained in accredited programs designed to increase the likelihood of favorable patient outcomes. The United States military continues to influence civilian EMS through their missions either in the United States or in foreign countries. Procedures, medications, and medical devices are vetted through evidence-based research. It is not enough to think a procedure, medication, or medical device may work or create a favorable door-to-discharge outcome. Researchers evaluate their efficacy to determine if it is reasonable to implement them as a standard of care. EMS services in Rhode Island are licensed to provide ambulance services by the Rhode Island Department of Health. They must adhere to strict guidelines pertaining to medical direction, ambulance design and construction, equipment par levels, medical devices, their calibration and certification, medication quantity, safety standards, documentation and communication, and EMS team configuration standards. EMS providers seeking a license to practice EMS in Rhode Island must first complete certification requirements set forth by the NREMT. Education and training requirements vary based upon the level of certification the candidate wishes to pursue. All candidates seeking ALS certification must first earn their EMT certification. Once EMS provider candidates have achieved certification, they may petition the State of Rhode Island Department of Health for a license to practice medicine under one of the following levels. The Rhode Island Statewide Emergency Medical Services Protocols is a document over 300 pages. It prescribes procedures, medication dosages, and patient care guidance. Paramedics and EMTs may also consult with an emergency physician at any time. Ambulances of today are equipped with diagnostic equipment, medical devices, and medications, all designed to increase the likelihood of a positive patient outcome. Critical care aeronautical EMS services provide critical care transport either from scene to the hospital or interfacility via a fixed wing or rotary wing aircraft. The mission of EMS today requires EMTs and paramedics prepare with special training and education to provide care in a host of formidable environments. In addition to the traditional emergent response, treatment, and transport role of emergency medical services, emergency medical services in the future will be moving forward towards mobile integrated health and community paramedicine. Certified EMTs and paramedics will work with patients in their home, assist them in understanding medication regimens, and maintain the patient's level of functioning through education. It is important that EMS services continue to staff their ambulances with highly motivated, well-educated, and trained medical professionals. EMS remains your partner in maintaining good health in the community. However, favorable patient outcomes start with early detection and intervention by you, the lay public, family, and friends. So if you see that your friend or loved one is experiencing a medical or traumatic emergency, stop where you are, call 911, and wait for EMS to come to you. Give your address, describe your location, and if possible, have somebody wait outside to flag down the ambulance. Don't try to drive your loved one to the hospital who's experiencing a medical emergency, and don't try to go to the station, as the emergency vehicles may be out on another call. We're here for you and working with you to create good health in the community. This concludes our presentation. If you would like to learn more about becoming an EMT or paramedic, go to www.harmonyfd.com or www.nremt.org. You may also visit the Rhode Island Department of Health website listed below.